physical therapist.
And I'm Brad Heining, physical therapist.
And together we are the most famous physical therapists on the internet.
In our opinion.
All right, is it working, Joni? You're looking like you're not having... What's wrong?
Chair's in the way.
Oh, well, we're going to be using the chair, so it should be in the way.
All right.
I want to see it. So we got a lot of our toys here today.
What are we going to talk about today, Bob?
Well, first, before I want to remind you, if you haven't subscribed already, you want to subscribe to us on YouTube because we're going to be talking about, for those of you who are 40, 50 and older, we're going to be talking about fitness and health well into your older years. So you want to make sure you subscribe to us.
Absolutely. We're going to have a lot of good information.
We're experts. We work with the elderly. We are elderly.
You are.
Okay. What we're going to talk about today is what I would call mid-back pain. Not low back pain, mid-back pain. Why don't you turn around, Brad? We're going to talk about, that's what we call the thoracic area. First 7 vertebrae are your cervical or your neck vertebrae. The last 5 are your lumbar. The 12 in between are your thoracic. So we're talking about from here to here if you're having pain. That's the kind of pain we're going to talk about trying to get rid of today.
Right.
And it's tough because those vertebrae are attached to ribs, and they don't move that well, and a lot of people have trouble with this. It's a tough one to
A lot of therapists have problems with it. Yeah.
Quite often what we find with when you have pain in that area is that you're having trouble with turns.
Right.
That's what one of the things we're going to look at, and we'll find quite often is that, well, I can turn this way well, but I can't turn this way well, or vice versa.
Sure.
So we want to try, one of the things you want to try is maybe try to restore those turns, that turning. And should we do the laying down one first?
Yeah, and I think I'm going to take one step back. General posture. You know.
Oh, absolutely.
If you're, I think, Bob, that's something that we think of so commonly. Right. We overlook it, but we got to talk about it. You know, if you're slumping, well, you got to change that.
No, that's probably how it was caused.
Right, exactly.
In fact, it probably was caused by you slumping and turning.
Yeah.
And those vertebrae are all kind of locked into place, and when you get in this position, they can actually turn and go out of place and give you troubles and facet problems.
Yeah.
So yeah, this is key. You've got to
get up, shoulders back.
Posture is number one.
You're in the Army now, type of thing.
So, all right, why don't we show the rotationals first? Brad, do you want to do that, or should I slip my shoes off? I can do it.
Yeah, I did that last time.
And we still smell it. Okay, so, believe it or not, if you want to turn your back, one way to do it is actually you lay flat, you bring your knees up, and when I turn my leg this way, I'm actually rotating my back to the right. So this is just a gentle way of restoring rotation to your back. Now if you want to get the mid-back, you got to bring your legs up fairly high.
Yeah, get them up.
If I'm down like this, I'm just really getting more of the low back.
Right.
So you got to get them up pretty high. And again, just start gently going back and forth. And then if it feels all right, you can even bring the leg over like this. A real advanced move would be to go like that.
Right.
And now that's where as you can see, I'm actually holding on to the mat here, or to your bed if that's where you're doing this on. And then you can work the other direction and stretch it that way too.
One point I want to make, if you're not going to go to that advanced level and you're going over like this, think about keeping this shoulder, your shoulders down on the floor or the table, wherever you're at, and this hip actually comes up and over. That's where you get that twist in the back, that stretch. So you should feel it here. This comes off, this stays down.
Exactly. So that's one way of getting rotation. Another way would be, you want to grab one of the canes, Brad,
Sure.
and show how you could do that with a cane in a seated position?
All right. You going to do it, or?
No, you go ahead.
Okay, this is what I like to do with people to get some rotation movement in that mid-back. First of all, you need to be seated. Seated with good posture, naturally. And then you take a dowel stick, a piece of PVC pipe, a cane, whatever it is, and you're going to put it over your shoulders like this and hold it here. Okay? Sitting down locks your pelvis in place so that is not moving. Holding your arms back here keeps your shoulders stable, and then you'll rotate back and forth like this. Okay? If you go this direction, you get a sharp pain, and you go this direction and it feels okay. I want you to work this direction 5 to 10 times, and then go back this way and see if you've gained range as a result of it. Sometimes you can work through that painful, but if it gets worse as you do it more, it's not the thing to work into, okay? So that's one way to work rotation with the back. Anything to add on that, Bob?
No, but that's a very good point about we actually work it into the range you have already.
Right.
And that, you know, if it feels really good going this way, work it that way. And it's amazing how it seems to also work,
right.
you know, help you increase the range the other way. This is a Thoracic. I think the Pressure Positive company also makes devices like this, but it's got a little knob on the end, and this is a great way also that you can do turns with this, get into your good posture, and you can actually find some of the tender spots on your back and push into the back while you're doing this, put a little pressure on it, and then do a couple turns like this.
Bob, why don't you turn around so they can see your backside? Sure. So they can see where you're using that. Sometimes they call it, what's the other name for the back knobber or something?
Yeah, there's
like
a whole bunch of
yeah.
names for it.
Okay.
This one is the Thoracic.
You're not going to go right on your spine on those bones. That's going to be uncomfortable. You're going to get into the muscle part.
Exactly, and you know, a lot of people have that trouble between the shoulder blades. Yep. So I'm pushing right on the spot here, and here I turn with it. And it just seems that combination really helps work some of this stuff out at times.
A combination of moving with the pressure on it, it's something that usually you're going to get that information from a therapist. It's not usually in the literature.
And again, yeah, stay off the bones with this. This
yeah,
can be comfortable.
yeah, it's you keep it on the muscle.
All right, another one that we do. You're gonna love this one. All right. Because quite often what you find out, the problem with the mid-back is because you are having posture like this, what we often find is by doing the opposite of that, moving the back in the opposite direction, we actually helps cure the pain. So this is flexion. We're actually going to take the back into extension.
Yep.
And so what we do is what we call the hallelujah stretch. You know, you're in church, hallelujah. So you bring your arms back.
Do that again, Bob.
Hallelujah. You know, now some
no.
people just go put their hands back
Right.
here and go back like this. But what you need, what's key with this is you need a chair that hits you around about in the mid-back.
You're right.
If it's too high, it's not going to work. You're just going to be going like this
Right.
on the neck. And if it's too low, it's not going to hit you in the right. You need a fulcrum, basically.
Yeah. I find computer chairs, those lower computer chairs actually swivel back. They're a little more comfortable. They're a little padded. If it's too hard of a surface here, it's a little uncomfortable sometimes.
Yeah, you got to go by with tolerances. If this makes things worse, if any of these things make it worse, you can't do it.
It should feel good.
It should feel good, or at least somewhat good, like you're heading in the right direction. Now, you can do the hallelujah stretch. The other thing I do, and I got a fair amount of flexibility, is that I'll do throughout the day. And I don't know if you can pick this up, Joni, because I'm tall, but I actually take my fists, put them way up here like this, and I just lean back. There, my back just cracked.
Yeah, I do the same thing.
I do this one all the time. It's a great one, and it prevents that incident from happening where you have the your back locks up in the wrong direction. So
and it's fun.
Fist.
I do the same thing. I just pull in like this, and there it goes. Ugh.
You don't really have any flexibility.
That's called cavitation. Would you just leave me alone, Bob? I got one thing I want to say though.
All right.
I just worked with a gentleman, and he is active in his 60s, and he's having these problems, but he had shoulder problems, and he was unable to do this just because he had problems with his shoulders chronically, long term. So you don't have to go back like this. Your arms can stay up here or here, but again, it's that stretch back here, and work with the height of the chair. You got something else you're interested in, Bob?
Oh yeah.
All right. Here we have a sock. This is a nice simple exercise. I've just used this in the last 2 weeks with a patient with a similar problem. This is a very key part of his exercise. You get yourself a tennis ball, actually 2 of them. You put them in an old sock. Make sure it's a clean sock though. You know, sure you get some dirty sock. Nice clean sock. Okay.
I'll get out of the way.
Now you can set that. You're not going to do this on your bed, but you do it on typically a carpeted floor. Okay. Now these 2 tennis balls.
Brad's just showing you for demonstration purposes why he's on the mat.
Right, exactly. Yeah, this is a little too soft.
You need a hard surface.
These 2 balls, why don't you come here, Bob?
Sure.
Face that direction, please. We're going to get these balls right here, one on each side of the spine, in the muscle area, not on the shoulder blades and not on the spine, but in this muscle area here. And they're going to use it for a pressure. Okay, we'll just put some pressure on there for.
This is an aggressive treatment.
Right.
So,
it'd be like soft tissue mobilization, we call it. Okay, and
what I have found, Brad, is I have found that people either love this or they hate it. They absolutely hate it. So it may not be for you.
And what you'll do is you'll roll your body up and down, and you'll find the spot where that knot is. And when you get on that spot, it's going to feel a little uncomfortable. But if it's the right thing, it's going to feel like that good pain that hurts so good type of a thing. And you'll lay there for 20 to 30 seconds, and that pain or that knot should release. It's gonna feel better, and then you're done. You don't lay on it for an hour or anything like that. 20 to 30 seconds, maybe a little more if it's really feeling good. And you might go to another spot. You can also take this, put it on a wall, and I've done
Oh,
this.
sure, yeah.
Here, can you get that camera over here, Joni? Yeah, shoot. Are you starting to shake like it's an earthquake? Okay, are you steady now? So I just simply put the ball against the wall, the tennis balls, and you can roll up and down. Actually, oh, I like that. Oh,
Ah.
yeah, I had a little tension dealing with that insurance company. I had a little, got rear-ended last weekend, and those insurance companies, that's why they make money, because they make you do things like I had to do this morning. I was getting ornery.
Okay.
That's good. Okay, one more.
All right, one more thing, kind of along the same vein, would be the use of a foam roller. If you're not familiar with these, you may want to look at our video on that. These are kind of a dense foam. They're used for a lot of self-massaging and
Right.
stretching of muscles. But you can actually, this is again pretty aggressive. You can start by just keeping your butt down and rolling back and forth on that mid-back range. And then to get a little more aggressive, you can even go like this and roll back and forth. And a lot of times when I do this, I can just feel the cracking going on there. Any other cues or tips with this, Brad?
Relax. You can tell the way Bob's talking. This is aggressive.
Yeah.
You know, you
This
need
is
to be
not-
fairly mobile and have some strength to begin with.
Yeah, this is not going to be somebody who's 70 or 80 years old. I'm not going to put them on this. But,
Or if you're real sedentary and you're just getting going on things.
so again, those are some things you can try. Give it a shot. See what what works for you.
And we're running out of time, Bob. We got to get going.
All right.
So
Peace.
take care.